3/100ths of a millimeter. That's what's protecting healthcare workers from catching or transmitting a deadly virus. Yet these masks are in short supply. Doctors having to reuse masks, nurses seeing multiple patients with a single mask.
Across the board, medical professionals are telling us that we need masks, we need gowns, and we need ventilators.
We showed Georgia's Attorney General this undercover video.
So $60 then?
$5 each, so for 20, that's 100.
A street deal with a mask seller we found online.
Here's 97.
The seller said he had more, a lot more. He texted us videos showing boxes of masks he's importing in bulk.
Are you doing this to help people, or are you doing this to make money, or both?
Both.
Both.
Because I have a supply, but the thing is I have over $150,000 of my own money out here.
Invested in this.
Invested.
This guy says he has a warehouse with pallets of hundreds of thousands of masks.
And that's exactly what it appears to me that the president's order was about. And if this individual had been into the medical distribution business for a while, that may be one thing. But if all of a sudden he's popped up and decided, this is going to be the field that we're going to be in, you got to follow the law. And it sounds to me like there are some troubling aspects of this particular case.
But if you are sitting on a warehouse with masks, you will be hearing a knock on your door.
But the federal government hasn't declared masks scarce. That declaration is required before federal agents can enforce the president's order. For now, enforcement has fallen to the states.
Anytime there's an emergency like we have now with the public health emergency, when the governor signs that into effect, our price gouging laws are in effect. You can't charge more after he signed the order than you could before.
The problem is masks were already selling for more than $7 each nationwide before Georgia's governor declared an emergency. It turns out this guy was selling them well below the going rate.
What are the masks costing you if you're selling them for $3 in bulk?
$2.60.
So you're making 40 cents.
Yeah.
We texted the seller after the transaction, identifying ourselves as journalists. Were you in the mask business before COVID-19? He replied, import, yes. Medical supplies was one of our imports. We texted back, when did you get into the mask business? Days later, still no reply.